Now, one of the most common health issues among males is the case of benign prostatic hyperplasia, BPH, which causes the prostate to increase in size. There is good news, as a new player in the complete removal of all sizes of the enlarged prostate without surgical cuts has come on board. It's called the thulium fiber laser enucleation of the prostate, TUFLEP, which is now available to Nigerians. So joining us on the show to discuss this is Dr. Paul Ngwu, a consultant urologist, laparoscopic surgeon and head of the Department of Surgery, Federal Medical Center, Umuahia, Abia State. Good morning, sir, and welcome to the program.
You're welcome.
All right, doctor, let's get straight into it. A lot of terminology there that's got our tongues twisted, so please help us to unpack it. What is TUFLEP?
Okay, TUFLEP is thulium fiber laser enucleation of the prostate. Thulium fiber laser enucleation of the prostate. That's what TUFLEP means.
You know, what is thulium? What is fiber? What is enucleation? What is prostate? English.
Okay, yeah. Thulium is a type of laser where we have the different types of lasers. We have the holmium laser, we have the thulium laser, and some other lasers that are also in the market. Now, for the prostate, the thulium laser came into is a new player on the block. We've always had the holmium laser, which is used for what we call a holmium laser enucleation of the prostate, HOLEP. So, but this new player is called thulium laser. It's a type of laser, an improved technology for removing the enlarged prostate without having to cut the body open, as it were. So it works with a fiber. If you look at the video, there's a fiber, a blue fiber, that's through which the energy, the laser energy. Laser is an energy that is used for a lot of things, both medically and otherwise. So the laser energy passes through the fiber and is used to remove the prostate from its covering for a complete removal of an enlarged prostate. That is what the thulium laser does. Thulium, that's why it's called thulium fiber. Then laser enucleation. Enucleation means complete removal. Enucleation, yeah.
What is prostate? For the benefit of those that might not know it, what is prostate?
Okay, the prostate is an organ that sits just under the bladder. It sits under the bladder. Every man has got a prostate. Every man that is born with a prostate. So the prostate sits under the bladder, and the prostate is one organ that keeps increasing in size as a man increases in age from teenagehood upwards. So the prostate keeps increasing in size. So as the prostate keeps increasing in size, because the bladder is just sitting above it, and the pipe through which urine flows passes through the center of the prostate all the way out for the ejection of urine. So as the prostate starts increasing in size, you discover that in a number of men, this pipe is being compressed by this progressively enlarging prostate. So that is what causes the issue of urination problems in men. Poor urine flow, difficulty in urination, and all the rest of them in men.
Prostate cancer, it is, as you've already mentioned, obviously a condition that only affects men, but also disproportionately affects black men, and that it's going to sound off alarm bells for Nigerian men. So when we're talking about the coming on board of this new treatment that doesn't need any surgical incisions, can you talk to us about the sizes of the prostate that can be removed through FLEP?
Okay, so for TUFLEP is categorically used for the enlarged prostate, benign prostatic hyperplasia, not for prostate cancer. For prostate cancer, we have other things that we do. But for men that just have an enlarged prostate that is causing an obstruction, they are finding it difficult to urinate. That is where TUFLEP comes in. Now, and for this procedure, it is used for the different sizes of the prostate. The average size prostate between 40 to 100 grams, but much more importantly, for the very big prostates, because for the average sized enlarged prostate that is less than 100 grams in size, the transurethral resection of the prostate top, can be very, very good for that. But when you now start talking about prostates that are quite big, beyond 100 grams, where previously we say, okay, the prostate is quite big, it's better you go for open surgery. These other players now, these enucleation processes using the laser can be used to completely remove even the very big prostates without the need for open surgery as well.
Okay, so I want us to get more clarity on prostate. I mean, tell us, why is it important? What enhances the growth? And how can men start to pick up if their prostate is growing in a big way at an early age? How can we start to pick it up? What can we do? The symptoms. So that we just have public clarity. Before I now ask you what are the advantages of this method for prostate removal. But let's just talk about, so that a lot of people understand it. Yeah. Why is prostate important? Why are we talking about it even? Yeah.
Yes. Yeah. Every man, like I said, has got a prostate. Every man has a prostate. So as the prostate starts getting enlarged, it starts obstructing the flow of urine. I've said that initially. Now, the importance of this lies in the fact that in our practice as surgeons, we see men come with issues of kidney failure. We see men come at the point of death because they have an enlarged prostate and they didn't know what to do about it when they were supposed to do something about it. Now, if a prostate gets enlarged and is blocking the urinary flow, the bladder gets distended and urine starts flowing back to the kidneys. When urine starts flowing back to the kidneys, you just discover that the kidneys will start going into what we call failure. And kidney failure is not something you joke with. Once your kidney fails, you are in a very big problem. The issue of kidney transplant and all the rest of them is not what a lot of people can afford. So prevention is still better than talking about taking care of the complications that come with an enlarged prostate that is left without doing. Of course, usually when the prostate starts getting enlarged and men starts having symptoms, of course, there are drugs that we do. There are conventional drugs, internationally approved drugs that we surgeons usually give patients. We urologists, we are urologic surgeons, the people that take care of the prostate. We give these drugs so that the essence of these drugs is to relax the prostate so that urine can start flowing out efficiently. But as time goes on, in some patients, you discover that these enlargements now gets to the point that it's no longer, the drugs are no longer sufficient. The drugs are no longer working, even for patients that are actually on these drugs. And that is where we now start talking about removal. And then, when you talk about the issue of removal of the prostate, of course, a lot of people are afraid of the issues of open surgery. Open surgery, to do this, to do that, to do that. So technology is steadily advancing. And of course, transurethral resection of the prostate came in, which helps for removal of the enlarged prostate, usually between the less than 100 grams prostate. For these very big prostates, these other technologies now, like the two flap you are talking about, can help with complete removal of the very big prostate, so that a man will not depend on catheter. I've seen men that will come, how are you? How long have you been on catheter? I've been on catheter for 15 years. That's very, very discomforting for a man to be on a catheter. A tube. Catheter is a tube that you pass into the bladder for urine to flow out for people that are finding it difficult to urinate. And meanwhile, this is a problem that can be solved, and within 24 hours, the person goes home.
Within 24 hours. Thank you, because I was going to ask, of course, we know that non-invasive would have a less of a downtime than, surgery itself. But are patients to expect any complications following the flip? Because, we know that all medical procedures have their risks. What are some of the complications associated with this new technology?
Okay, so when you talk about two-flap, the complications of surgery in patients that have an enlarged prostate, these newer technologies like two-flap that we are talking about today, whole lap, have helped us to go a long way in mitigating these complications to the barest minimum. Now, one of the complications that people fear with the issue of enlarged prostate and the surgery of enlarged prostate is the issue of bleeding following the surgery. Now, for a patient that had a two-flap surgery, you finish the surgery and the urine is clear. There's even no bleeding there, even for a very big prostate, because these are machines that work with very good magnification, so that in the process of removing the prostate, the bleeders are seen very clearly and taken care of with the laser. So you just discover that you're not even seeing any bleeders as you're moving on. So you discover that you remove a 150 grams prostate, 200 grams prostate, 250 grams prostate, and you don't need to give a patient blood. There's no need for blood transfusion at all. And so that takes away that issue of transfusion, bleeding from removal of prostate. Another issue that people usually might have is the issue of incontinence. You discover that urine is flowing out uncontrollably following the removal of someone's prostate. Of course, the issue of incontinence for most patients within a week, 2 weeks, 3 weeks, with pelvic floor muscle exercise, they overcome it. But with two-flap, this is also reduced to the barest minimum. Most of the patients will finish two-flap because of the precision of the laser. You discover that you make your cut and get to remove the prostate, avoiding the sphincter. So that way, the issue of incontinence is also reduced to the barest minimum. Another thing people talk about is the issue of urinary tract infections that can occur after surgeries. That is also reduced to the barest minimum. You rarely see people have those things. Another thing people fear is the issue of erection. A lot of people will ask, will I still maintain my erection after my prostate is removed? The good news is that these technologies, two-flap, whether it's two-flap, whether it's whole-lap, even transurethral resection of prostate, will not affect erections. Once it is done with the modern equipment that we use, it does not affect erections. So you discover that patients will finish these things. Once it is done by the appropriate people, by the urologist, you finish these procedures cleanly and patients go home and they're not having an erectile dysfunction. But for a patient that already has an erectile dysfunction before the procedure, you don't expect that erections will come back after you've had your procedure, because there are some patients that come and they think, okay, I have an erectile dysfunction and my erections are not there, but I'm believing that after removing my prostate, my erections will come back. No, erections do not. It's not a treatment for erectile dysfunction. Neither will it cause erectile dysfunction for patients.
Okay, so a couple of questions. Where can people get this two-flap, or how can they get more information about it? Secondly, what will be, your words for people that are suffering this? What should they do? Are there any contacts? Are there any, people you can reach out to? All of this should be answered briefly, and advise young men what to do about their prostate if they see any problems. Quickly.
Okay. Now, of course, the essence of this is for public health education, so that people will know that there are solutions to these problems. Now, of course, if you go on Google, if you type two-flap, whole-lap, minimal invasive surgeries, all those informations are there. They are also there in some of our hospitals, mostly private hospitals. So, of course, as doctors, I'm a surgeon, and as a doctors, we are usually not allowed to advertise. So the essence of this is for public health education, for people to know that these facilities are available, readily available to our patients. Two-flap is available to our patients. Our other minimal invasive procedures are also available to our patients as well.
Indeed. Well, thank you very much, Dr. Ngwu. That was such an insightful and important discussion. Thank you for joining us.